Additional tasks. For all patients, whether triaged red, orange, yellow or green, immediate additional tasks may be indicated to stabilize the patient or identify or prevent potentially serious complications. Check if the patient has any of the conditions in this section and perform the task accordingly. Poisoning or overdose. Patients, especially children who have ingested substances, can deteriorate quickly. They may need a specific antidote. If a medication has been ingested recently, immediate intervention may be needed, like giving activated charcoal. Refer to the senior healthcare professional immediately. A child with inconsolable crying or a child in pain. This may be due to medical causes like severe otitis media or meningitis, or something obvious like a dislocated joint or other trauma. Pain will affect the TEWS and is obviously unpleasant for both the child and caregiver. Check with a senior healthcare professional for initiation of analgesia and review. If the child has a burn, he or she will be experiencing pain and has the potential to deteriorate rapidly. Consult the senior healthcare professional for analgesia initiation. If the burn occurred recently within 3 hours, cool the burnt area with water. The child should then be dried and wrapped. The burn can be covered in cling wrap if available, or a clean dry sheet or towel. Temperature 38.5 degrees Celsius or more. A very high temperature results in physiological changes that may affect the TEWS and makes the patient feel uncomfortable. Remove excessive clothing and discuss with a senior healthcare professional who will most likely prescribe paracetamol and tepid sponging to reduce the temperature. If the temperature is 35 degrees Celsius or less, hypothermia might be a sign of severe sepsis with very small babies, ex-premature babies and severely malnourished children being the most at risk. Warm the child with additional blankets and a cap if available, and hand over to the senior healthcare professional. If the child has diarrhea. Even if the child has no or some dehydration, the child is at risk of becoming dehydrated whilst waiting to be seen. Take the child to the oral rehydration therapy corner and advise the mother to start giving oral rehydration therapy by cup and spoon. Vomiting without diarrhea but with dehydration. This may indicate a surgical problem with bowel obstruction, a diabetic ketoacidosis, or even meningitis or another severe infection. Hand the child over to the senior healthcare professional for assessment. If the presenting complaint is abdominal pain, this may be indicative of a urinary tract infection, diabetic ketoacidosis, hepatitis or other causes. A urine dipstick will assist in excluding or diagnosing some of these. For the younger child, place a urine bag. If older child, give urine container. If the child has a closed fracture, these children will be in severe pain. Medication and immobilization of the affected limb will provide some relief from the pain. Check with the senior healthcare professional for analgesia initiation. If required, get a wheelchair or stretcher and immobilize the affected limb with a simple padded splint or a triangular bandage sling. Active ongoing bleeding. Children have a small circulating blood volume and are at risk of becoming shocked rapidly. For both adults and children, apply pressure to the site of trauma with a dry dressing. Perform a finger prick hemoglobin to obtain a baseline and hand over directly to the senior healthcare professional. A history of recent bleeding. This child may be anemic from blood loss. Check the finger prick hemoglobin. If it is less than 8, then hand over to the senior healthcare professional. For adults with a history of bleeding or bleeding PR, PO or from the site of trauma, do a finger prick hemoglobin. Adult males with abdominal pain or backache require a urine dipstick. Adults with PV bleeding, urine dipsticks, urine pregnancy test, and finger prick hemoglobin. In summary, a senior healthcare professional should be alerted about children with these conditions: tiny baby under 2 months old, reduced level of consciousness, a child in pain including burns and fractures, poison ingestion or overdose, very high or very low temperature, vomiting only with dehydration, the severely malnourished child, and a child with active bleeding. These additional tasks may assist to rapidly identify very ill patients and prevent and identify serious complications. They also improve quality of care by providing relief from pain.